In this exercise, I'm going to use a myofascial ball on the side of my hip. I'm going to turn around just to show you the area that I mean. So the side of your hip is here. You can feel that there's a top of the bone here which comes round to the front, and it then comes all the way round to the back. And in this area, on top of the bone, are a number of muscles and a lot of fascial tissue, and the job of these muscles is to rotate your leg as you walk and you run, and particularly rotating out but also back in. And this is the natural movement of your leg when you are walking or running. Sometimes this area gets restricted and it means that your leg can no longer freely rotate, and that's when problems start to develop. So we're going to place the ball here on the side of the hip. So just make sure when you start that you feel the bone and you know where you're going to be placing the ball. So when you're here, make sure that you feel comfortable and you allow time for your body to relax around the ball. At first it can feel a bit uncomfortable, especially if your hip is tight. But as you relax here, you'll start to get a sensation of the tissues releasing and changing. Now when you're working here, you don't have to be precise. As long as you have the ball on the bone on the side of your hip, then you will be releasing the tissues here. You can move your body around the ball if you feel that there are other areas that you want to work on. And sometimes people find that this is easier to do if they do this exercise standing and leaning against the ball against a wall. So whatever works for you is fine. The main thing is to be here for at least a couple of minutes, as this allows time for the tissues to start to release and let go. And you may find that you feel sensations here while you're lying on the ball. And working here is particularly good for lower back pain and even for knee pain. And so now I'm going to work on the other side. Again, on this side, making sure that the ball is placed on the bone on the side of your hip, because this will then start to release the tissues, the muscles that sit on top of the bone. So for a lot of people, if they have restrictions in the side of their hip here, it can contribute to lower back pain. And that's because if your leg is not freely rotating as you walk or you run, then the force will have to go somewhere else, and very typically it comes up into your lower back. But equally for some people it actually travels down their leg into their knee, so particularly down the outside of the leg into the outside of the knee. And again, that's because the leg is not able to freely rotate in your hip. And so by working here, you can start to help the tissues to release and restore that rotational movement in your leg, which takes the pressure off your back and it takes the pressure off your knee. Again, you can work on this side either lying on the floor or on your bed, or you can do this leaning against a wall. Whatever feels comfortable for you is fine, and as long as you're here for at least a couple of minutes, then it's allowing time for the tissues to start to release and let go.